Atherosclerosis is a life-threatening disease that may have begun to develop during childhood. This condition is a process in which deposits of fatty material, called plaque, build up inside the walls of arteries, reducing or completely blocking blood flow. In extreme cases, this disease can lead to a heart attack or a stroke. Risk factors for atherosclerosis include high blood pressure, high cholesterol, tobacco smoke, diabetes, obesity, and physical inactivity. Although the exact causes of atherosclerosis are not clear, many scientists think it begins with damage to the inner wall of an artery called the endothelium. Over time, substances traveling in the blood, such as cholesterol, fats, and cellular waste products, accumulate inside the damaged area of the arterial wall. Chemical reactions occurring within the buildup of material cause cholesterol molecules to oxidize. This initiates an inflammatory response in which the endothelial cells at the damaged site release chemicals that signal a call for help. In response, monocytes from the bloodstream travel to the damaged site. Stimulation from oxidized cholesterol converts the monocytes into macrophages. The macrophages eat and digest the cholesterol molecules. As a result of this process, the macrophages change into foam cells, which accumulate to form plaque. As the plaque increases in size, the arterial wall thickens and hardens. At the same time, smooth muscle cells within the arterial wall begin to multiply. Then, most of the smooth muscle cells move to the surface of the plaque. These cells contribute to the formation of a firm, fibrous cap covering the plaque. Over time, the cap may erode and break open, releasing plaque into the bloodstream. The plaque can flow downstream and contribute to the formation of a blood clot, which can stop blood flow. As a result, limited blood supply is available to the areas surrounding the partially blocked artery, degrading and potentially killing the neighboring tissue. Significant damage in organs, such as the heart or brain, can result in a heart attack or a stroke.
Angioplasty is a non-surgical or interventional procedure for patients who suffer from a narrowing or blockage of arteries caused by the buildup of plaque that restricts the flow of blood and nutrients to the heart, a condition known as coronary artery disease.
The reason a patient has a cardiac cap is because there is a suspicion of bad blockages in their arteries or a bad valve, and you need to do a diagnostic test to accurately determine what the problem is.
Angioplasty is actually life-saving for patients with very acute cardiac problems, such as acute heart attack. There's another condition called ACS, or acute coronary syndrome, where early angioplasty has also been found to be life-saving. In addition to that, there's a large group of patients with angina who are more stable, where angioplasty has been found very useful for relieving their angina.
During the catheterization, a guide wire is inserted through the groin, followed by a thin tube called a sheath. Another thin, hollow tube called a catheter is guided through the sheath to the arteries surrounding the heart. Dye, or contrast material, is then injected into the catheter. As the dye moves through the arteries and chambers of the heart, its movement is digitally photographed so the physicians can identify the locations of the blockages. After the location of the blockage is identified, the catheter, with a small balloon at the tip, is then reinserted near the blockage or the narrowing in the arterial wall. When the catheter reaches the blockage, the balloon is inflated, pushing the artery open and widening the blood vessel enough to increase the flow of blood and nutrients to the heart. Oftentimes, balloon angioplasty will involve a metal stent, which serves as a brace and keeps the artery open after the balloon is deflated and removed. The stent stays in place and the arterial wall heals around the stent with blood flow restored.
Noncardiac percutaneous transluminal angioplasty. A surgeon will perform a noncardiac percutaneous transluminal angioplasty, or NCPTA, to restore blood flow in an artery blocked by atherosclerotic plaque. Fatty deposits called atherosclerotic plaques can build up inside your arteries, narrowing the passageway and interfering with blood flow. This arterial blockage is called stenosis. Insufficient blood flow to a tissue generally causes pain. A noncardiac percutaneous transluminal angioplasty is only done when your condition has not responded to less invasive treatment options, such as lifestyle changes and medications. To begin the procedure, you'll be placed on a table equipped with a fluoroscope. A fluoroscope is capable of taking X-ray images of many parts of the body from multiple angles. Your doctor will numb your skin around where the catheter is to be inserted. Since the arteries of the leg are most easily accessed, the femoral artery in the groin serves as the insertion site in most cases. Your doctor will initially gain access to the artery by inserting a hollow needle through which the balloon-tipped catheter is passed. Watching on the fluoroscopy screen, your doctor will gently advance the catheter until it is positioned in the artery being treated and inject a special dye. This dye allows the fluoroscope to take X-ray images, called angiograms, which lets your doctor identify the exact location of the blockages. Next, your doctor will move the catheter until the deflated balloon at its tip is positioned at the site of the stenosis. Then, by rapidly inflating and deflating the balloon, your doctor will gently push the plaque and vessel wall out, partially reestablishing blood flow. This procedure may be repeated for any additional blockages. In some cases, your doctor may place a stent, which is a wire mesh that remains in the artery, to hold it open. To perform this procedure, your doctor will place a collapsed stent over the deflated balloon on the tip of the catheter. When the balloon is inflated, the stent expands and locks into place. At the end of the procedure, your doctor will remove the catheter through the original insertion site. After your procedure, a pressure bandage will be applied to the catheter insertion site, and you will be asked to lie still to prevent bleeding. You will be carefully monitored in the recovery area to be sure blood flow through the affected artery is maintained. Most patients are discharged the same day as their procedure, but some remain in the hospital 1 to 2 days for observation.